patient is a 42-year-old gentleman who presented to me for evaluation of a progressive bilateral knee pain and disability. His pain and disability had progressed in spite of conservative measures, and his preoperative physical examination and studies were consistent with the above stated preoperative diagnosis, which is bilateral knee medial meniscus tears and chondromalacia. Findings. Exam under anesthesia showed grade 3 changes in all 3 compartments in both knees. There was a small grade 3 lesion on the lateral femoral condyle and larger on the medial femoral condyle. Margins were unstable at all 3 compartments. There was a complex posterior horn tearing of the medial menisci in both knees. Menisci is basically both meniscus in his knees. So menisci is plural. The following procedure was performed in both knees. After identification in the preoperative area and after giving antibiotics by IV, patient underwent induction of an adductor canal nerve block and then was brought to the operating room where the patient underwent induction of LMA general anesthesia. Exam under anesthesia was then performed with the findings noted above. After sterile prep and drape, an outflow of cannula was placed supramedially and the arthroscope placed through the anterolateral portal in the suprapatellar pouch and the knee in all 3 compartments sequentially examined with the findings indicated above. Just a bunch of fancy words, basically let you know that he was giving local anesthesia, and then you were given general as well. So just basically fancy words for saying they
knocked me out.
Gave him a local in the area first, which probably would kept his pain level down throughout the day, and then they gave him a general one, like you said, to knock him out. The sterile drape is basically they drape the area, keep it sterile and clean, so less chance of infection. Partial medial and lateral meniscus were then performed with straight and angled duckling punches from the anteromedially and anterolaterally. A small shaver was used to evacuate fragments and smooth remnants to a stable margin. A 3-compartment chondroplasty was then performed with a small shaver, and then 3-compartment synovectomy performed with a small shaver from anteromedially and anterolaterally, as well as from supromedially. Knees were copiously irrigated, which means cleaned out, and portals closed with a simple interrupted buried vicryl and steri-strip. So a simple interrupted is a type of stitch that you put in someone. It's the type that has the little knots on the ends. A vicryl stitch is one that is placed internally and will dissolve on its own. These are the steri-strips. The steri-strips were placed over top of the vicryl sutures. Sterile dressing and thigh-high TEDs were placed. TEDs are a compression stocking. No complications and minimal blood loss. So that means he didn't bleed very much and they didn't run into any issues outside of the norm. That will conclude the bone and joint surgery note of David Williams.
What about the pre and post-operative findings?
I did the pre. So the post-operative findings were similar to what he expected, but a little bit more in depth. Bilateral knee medial meniscus tears, plus lateral meniscus tears, 3-compartment chondromalacia, and 3-compartment synovitis. So it looks like.
So I had a meniscus tear on the inside and the outside on both knees.
So
and he removed those.
He had meniscus tears on both knees, inner and outer. And he also has some